have time in the future.
And the last ex officio presentation, Mike Miller, CDC.
Thank you. The revised CDC CFS Public Health Research Program 5-year plan is now posted on our website. As you recall, in November of 2008, we had a peer review that actually requested and recommended that such a plan be developed for the research program, and that has been done. And you also recall that in April of this year, 2009, we convened a public meeting. We had discussions with a number of collaborators. We received input following the CFS Advisory Committee meeting last May. And then between April 27 and July 30th, we actually had over 1,200 responses to our strategic plan. And we read every one of those, and I can tell you that we appreciate your concern and your input in sending us those comments. Many of those were directed toward the strategic plan itself, and as a result of those public comments, the plan and our research program is designed or categorized around 7 topic areas. Those are the pathophysiology of chronic fatigue, the causes of chronic fatigue, diagnostics, in-hospital and pharmacologic studies, treatment and management of illness, provider and public education, and CSF in children. And as you will see, the strategic plan actually addresses each one of those. Many of those were enforced and reinforced by the public comments. In addition, we've had considerable progress made in addressing the peer review panel's other major interrelated concerns. For instance, the lack of engagement with government public health agencies, the lack of participation in large CDC databases, and lack of participation in the Epidemic Intelligence Service, the EIS of CDC. And so responding to each of those, the program has now successfully recruited and has an EIS officer and is already recruiting for the next class of EIS officers. So we will have a specialist epidemiologist associated with that program. The program has presented abstracts at the Behavioral Risk Factor Surveillance System meetings of the Agency for Toxic Substances and Disease Registry, and in the Public Health Information Network conferences. We've expanded our doc-style survey, and over the summer we've met with the National Association for County and City Health Officials and the Association of State and Territorial Health Officials to identify the best manner to address the concerns of all of their CFS constituents. And we've done these surveys now in over 18 states, and those results are being evaluated. A number of other activities have been interesting, particularly addressing the etiology of CFS in terms of viral etiology, where the program is collaborating with NIH to evaluate a possible role of the human herpes virus 6, the HHV6, in CFS, and this will address both subtypes of the illness and pathophysiology, in particular reactivation of the latent virus. We're all interested in the work of a collaborative group, including the Whitmore-Peterson Institute, the National Cancer Institute, and Cleveland Clinic, where they reported an association between the retrovirus XMRV and CFS, and we were excited to see that as everyone was. The retrovirus program within HIV at the Center for Disease Control is taking the lead and is testing defined specimens from specified patient populations to see if those results can be generalized into a general population as opposed to patients that are seen in illness clusters. So we are looking, the retrovirus laboratory is looking at the populations from the Wichita study, the Georgia study, and are actually using split samples from the Whitmore Institute to try to confirm those results. Also in the strategic plan, you will see that we are looking at using molecular techniques, multiplex technology to look at a number of viral etiologies, partnering with people outside of CDC to do that. In terms of CFS in children, the governor of Georgia actually contacted us recently and wanted us to determine the prevalence of unwellness among adolescent wards of the state. And this would be, I think, an opportunity to evaluate incident CFS in an adolescent population, and we are actively working to begin and engage in that study. Using this foster care system allows for implementation of early intervention with long-term follow-up, so there's some real interesting and good possibilities at that point. We're also working with Mayo Clinic in Rochester and their epidemiology project, and the goal of this collaboration with Mayo Clinic is to utilize their medical records from the Rochester epidemiology project to study the risk factors associated with the incidence of CSF in this huge population within an entire counties where Mayo Clinic is associated. This retrospective study will allow us to categorize risk factors associated with CFS. Now, there's been a request a number of times to move the CFS program out of the National Center for Zoonotic Vector-Borne and Enteric Disease, where it now resides, to move it to a chronic disease center. And by others outside of CDC that has used one of the large data sets, and the Duke University Camden exercise has published those papers. The public awareness campaign, I thought I'd bring you up to date a little bit on that campaign. As of September the 30th, the public service announcements have been distributed, has aired almost 16,000 times. Reaching a total of 115 million viewer impressions is what they call it, and approximately 129 hours of airtime, and that translates into $966,000 value. As of September the 30th, the various versions of the public service announcements distributed in 2006 have played over 25,000 times on 216 radio stations across the country. In the third quarter of 2009, almost 6,500 copies of the patient brochure, Understanding Chronic Fatigue Syndrome, a guide for patients, has either been directly distributed or downloaded from the websites. The CSF toolkit for healthcare professionals have been either distributed or downloaded almost 11,000 times. So that's been a very active and I think very successful campaign.
Thank you. Any